Hi, Denise.
Hi.
Okay, so I asked Denise to come by because I know it's summer season and most of the things we have in the show are geared toward grilling and chilling and barbecuing and beaching. But regardless of any of that, or even whether it's winter, spring, summer, fall, we all need to sleep. And I remember recently seeing my buddy Alberti Popage, who is a fellow host of mine, presenting this item with you.
Yeah.
And it was unbelievable, the things that he was saying and also his experience with it.
Yeah.
So it's called Relaxium, and we've sold about 10,000 of these. It is a daily supplement. It is, you take 2 of them, so you're getting a 2-month supply, invented by a clinical neurologist out of the state of Florida. And if you go to their website, you will see the other news media and celebrities who have struggled with sleep and now don't. Tell me a little bit more about how this works.
Okay, well, Dr. Eric Ciliberti, 15 years of research into Relaxium. You see this all over. It's all over your favorite cable channels. People who have issues with sleep. He's done all the homework. So he's done all the research. He's got proprietary blends of 8 different ingredients. So I personally have struggled with sleep since I'm 14 years old. I have had bioidentical creams, I have used oils, I have used allergy medicine, I have used prescription medicines, which I don't actually like to use. I discovered Relaxium in January, and I've never looked back. Why do I love it? Because it works, number one, and it doesn't feel like I'm drugged or sedated through the night or waking up the next morning. I feel almost as if I'm just sort of peaceful, being held. I equate it to rocking a baby, or almost maybe if you're not used to rocking babies, you're not familiar with rocking babies, how about lounging in the ocean on a raft and just feeling that lull and that drift? That is the sensation that I get. So I used to have issues staying asleep. As I got older, falling asleep and staying asleep became an issue. So that's where the 8 different ingredients come in with Relaxium, because they're proprietary. So you might have a couple of deficiencies with maybe 1 or 2 things. I might have 2 separate things. Somebody else might have. All 8 things are in this small sized capsule. Here's your ingredients. So your melatonin is your body's circadian rhythm. It's our sleep patterns. The L-tryptophan is an amino acid that's found only in turkey. So think about when you get sleepy after a Thanksgiving dinner, it's because of the L-tryptophan. The magnesium, there's 24% of the recommended daily allowance in here. And honestly, almost half of American adults don't get enough magnesium. The ashwagandha helps promote stress and relaxation. And when you take that even at the 2 and the 4 mark period, it really kicks in with that stress and relaxation situation the longer you take it. The valerian, this is our Valerest. Now this is something very unique and proprietary to this brand. Dr. Ciliberti again did all the research. So it is a special blend of valerian root and your hops, and that's what that is. And then of course you've got the chamomile and the passion flower. Those are our sleepy time teas that we're all very familiar with. And then we have GABA. GABA is that chemical messenger in the brain. So all of the ingredients, all in here. He's done all of the homework. You don't feel sedated, you don't feel drugged. You take 2 capsules about 30 to 60 minutes before bedtime. They're average sized capsules. And this is 2 months worth, 120 caplets in this deal.
It's gluten-free.
Yeah.
It's vegan. Again, it's not just melatonin, which is such a buzzword we've all come to learn. So like a lot of times people will go to the natural food store and just buy melatonin.
Yeah.
He, this neurologist who obviously studies brains, both active and at rest, has concocted an entire cocktail, a powerful cocktail of botanical extracts in order to help produce natural, authentic sleep. And I'll tell you, they ship for free. You're getting a 2-month supply. Now I have a couple questions for you. Number one, can you take 2, like 30 to 60 minutes before bed?
Correct.
Does it have to, let me start over. Does it work right away, or do you have to take it for a couple days and build it up in your system?
I found it worked right away. Now, having said that, everybody's going to have their own different unique experience. For me, the first time I took it worked instantly. I've taken melatonin on its own. Melatonin on its own did not work for me, so I love that there's all of these ingredients in here. We all know There are 3 pillars of health. Most important ones are your diet, your exercise, but sleep is becoming the most important one these days. The stresses of life, the anxiety that we have.
Menopause.
Menopause.
Melly talks about this all the time.
All
I
of
do
it.
too.
So this is just amazing.
Second question,
yes.
With regards to this is, like when my husband or I sometimes struggle to get to bed and we know we have something important the next day, and we aren't wanting to go so far as to take something prescriptive,
right?
Yeah. Like it's very easy to just go behind the bathroom door and be like, "Can you grab me some of that cold syrup?"
Yeah.
You know what I mean?
Yeah.
But the problem is, you wake up the next day and he's always like,
Right.
"I feel like I got hit by a truck."
Exactly.
So is there any?
No,
There's nothing.
no hangover. So you don't feel like you're drugged or sedated. And the next day, when you have to perform, you have to go to work, you have to be there for the kids, you have to get up. You don't feel like you need a couple of hours for that to happen. You need to slam a couple of cups of coffee. This really does not give you that too much situation. I fall asleep nicely, I stay asleep nicely, less tossing and turning for me. It's just a very peaceful, honestly, I feel the very first time I took it, I was such a skeptic. I'm like, I've tried so many different things, I can't imagine this really working for me. Worked for me the first time, and it gave me the sensation, and maybe because I'm a grandmom now and I'm rocking 8-month-old babies. I mean, I've been a grandmom for 10 years, but the 8-month-old babies are really special. So it gives me that sensation of holding a baby, rocking the baby, and just having that, it's a peace.
Well, there's like with rocking, like what you were saying with the circadian rhythm.
Right.
There's a constant rhythm.
Yeah.
And it's
in your bodies.
It's just like it really does kind of lull you into this place.
Yeah.
And what I'll tell you is, because we're busy on the phone lines, with 600 out the door, you can add to that the 10,000 ordered since this debuted, which, believe it or not, is relatively new to the queue. It's only been around since April.
Right.
These ship for free, and you're getting a 2-month supply. And I will just tell you, like, you have nothing to lose and certainly everything to gain, because we always talk about with Denise and pretty much everybody, we know how important sleep is. I think it expedites your aging exponentially, whether it's, you know, visually, facially, or just internally, when you're not getting rehabilitative sleep.
Right.
And so we know it's important for our daily performance on a job or whatever, but it's a game changer if you're not getting it and consistently not getting it, in terms of impacting the total quality of your entire life.
Absolutely. Not to mention your relationships. Like if you're sleep deprived, or you're moody, or you're grouchy, it's hard to focus on life, let alone a relationship, or just being pleasant, or being kind, or being amenable. You know, for me, this has just helped me in all of those realms of my life, because it's simple and I don't feel it like it's too much. And I don't know why I'm getting froggy today, but it's really truly one of those 3 pillars that we talked about. We all know how important our diet is and our exercise is, but sleep is rapidly becoming that #1 thing that's so important. And Dr. Eric Ciliberti, 15 years of research, renowned clinical neurologist, with issues, deficiencies that people struggle with their sleep, with problems. All of these ingredients, he did that research for us. So you're not going to go out and have to find valerian. You're not going to go out and find how much melatonin. He knows the perfect balance. So the melatonin we talked about, that's your circadian rhythm, that's your body's internal clock. The L-tryptophan, the amino acid found only in turkey. You get that, the magnesium, there's 24% of the recommended daily allowance. About half of American adults don't get it. The ashwagandha helps with stress reduction, and that becomes more efficacious at the 2 and 4 weeks. So the more you take it, the even more better it is. That Valorest, unique proprietary blend, only Dr. Ciliberti and Relaxium has it. The passion flower and the GABA, all of the things in these 2 little capsules.
Honestly, if you are opposed to taking anything stronger that's ingestible, which I understand, trust in the fact, thank you, Miss Denise, that a doctor and a neurologist at that, a clinical neurologist, invented this formula. And gosh, if you struggle with sleep, I mean, to hear Alberti wax on about how this has really changed his life. All right, listen, I don't know how we got here, but we got here. And we got one more thing